The number of unmarried women giving birth in our state is on the rise. That's a conclusion from an annual report just out today. The Right Start in Michigan report found the amount of unmarried women giving birth has risen 20% between 2000 and 2009. The rate of single mother births are the highest in women between the ages of 20 and 24. The findings mirror national trends, but concern family advocates in our state since we had one of the nation's highest jobless rates for years. Now, to take a look at the full report, you can go online to woodtv.com.
And it's a big report with a lot of layers. And joining us now in studio to talk a little bit more about this, Teresa Branson, Public Health Supervisor with the Kent County Health Department. Teresa, thanks so much for your time
You're
tonight.
Welcome.
4 out of every 10 births in Michigan to unmarried women. We were all curious, does this have more to do with the economy here in Michigan, or does it have something to do with changing socio-morals?
I believe, when you look at the data, there's a lot of different types of variables that could contribute to the fact that what this report is showing with there being more births to those women that are ages 20 to 24. However, the report doesn't provide those underlying factors that could be attributable to that. But one of the things, when you look at the report that was put out by the Right Start in Michigan, there's several indicators, and that was one indicator that was on there in relationship to the unwed mothers that were giving birth. The other indicators, even in Kent County, we saw a lot of improvement with the increases in, or less women having preterm births in Kent County, less women having low birth weight babies. The fact that we had less teens giving birth and less teens having repeat pregnancies, I think shows what's working in this community.
Yeah, what do you attribute the successes, I guess, in those areas, and how can we capitalize on that and continue to build on some of those numbers?
Well, thanks for asking that question. At the Kent County Health Department, we have a lot of support programs that are in place that are working. These programs are evidence-based. We have nurses and social workers and dietitians that are going in and working with mothers that are in maternal infant health programs. We have a program which is called Nurse Family Partnership, which is based on an evidence-based model, and interconception care programs that focus on the health of the mother before she becomes pregnant. Again, and these programs are the programs that are working in this community that are attributable to these indicators that we've seen the needle move in the same report.
Obviously in 2011 here, there's not really that stigma that's attached to being an unwed mother anymore, but it does have its disadvantages.
Yeah, there's no doubt about that, in Kent County and throughout the state of Michigan, we want to make sure that mothers are ready for pregnancy, and that's why we need more programs to support access to family planning services. These are the same programs that oftentimes get cut, and our nurses at the Kent County Health Department, as well as other healthcare institutions, are working to ensure we have those support services in place to support these moms and their infants, to kind of really put them on the path to having good health outcomes.
Yeah, there's help out there. They need funding, though. Teresa Branson, Public Health Supervisor with the Kent County Health Department. Thanks for coming in.
You're welcome.